Hello, my name is Karl Dixon. I am the dental hygienist here in the practice. I've been a hygienist for 35 years. First male graduate from the University of Medicine and Dentistry, which is now Rutgers Dental. I'm also adjunct faculty at New York University. I've been there for now 20 plus years. And I teach dental anatomy and clinical dental hygiene. And I've been with Dr. Gross 32 years. My favorite thing about being in this practice certainly is the longevity that I've had with the practice, because I've had patients for 30 years and I see some of the same patients that I've seen for 30 years. So if you can imagine, they started with me when they were 30, now they're 60, or they started with me when they were 10 and now they're 40. So I have grown with them through the life of their teeth. And I also do generations. So I do the mother, the children, the grandchildren, so the grandparents. So we all kind of have this wonderful community of dental specialists. I'm a holistic hygienist because I work for a holistic dentist. There is no recognizable discipline, certainly as a teacher in university. So I had to kind of create it. And what has been really beneficial being here so long is I was able to create it with my patients that I know what they're going to do, and I know their compliance, I know their history. And as he incorporated the holistic ideology more into the practice, I had to figure out how that's going to work for the patient. What does that really mean for the patient? And it was a real challenge. But what I was able to do, and I'm very grateful that I was able to do, was to work with patients, and we created a holistic modality. And that works individually for the needs of the patients. And Dr. Gross's product certainly supports that. One thing that is very important for the patient to understand, and when you're thinking about cleaning your mouth from a holistic perspective, the epiphany that I had, that I share with every patient, is if your hand was your dirtiest limb, would manicuring your nails alone make it clean? So if we're only manicuring our teeth, are we really addressing the problem in our mouth? If we go more back to the root of the problem, or kind of go to the origins of the problem, pH, which is the acidic levels in your mouth, is certainly important to manage and to be able to control, because that's how the acids are going to get their potency to cause the decay. Bacteria has to be controlled. So how are we controlling the bacteria? Not just on the teeth, in the mouth in general. So when you're talking about having a more holistic approach at cleaning your mouth, we're looking at the entire mouth. Here in this practice, also I've had the benefit of working with the nutritionist and working with some of the other specialties that we have in the practice to see what is going on in the patient's mouth. Why are the patients having recurrent decay? Why can't we control the periodontal disease or the sensitivities that the patient has? And it largely has to do with not being able to control pH and bacteria. So what we try to do, and I try to encourage the patients, is to let's kind of go rewind it back. Your mouth is most acidic in the morning. So to control the acidic level at night before you go to bed would be brilliant. That would make lots of sense. If you're going way back to some more traditional techniques, rinsing with ginger water certainly can do that. Controlling the bacteria, coconut oil controls the bacteria. And then certainly that's been also very widely talked about in the holistic community. The oil pulling process, which my patients and I really did. It's a lot. It's a lot. The actual technique is 20 minutes up to 40 minutes over a 21-day period. And not only are you killing viruses, you're pulling up toxins, and you're coating everything with bacteria. This is before toothbrushes were invented. So I kind of hope the toothbrush would speed up the process a bit. So with the patients, we were able to speed it up a bit. And then we also found that spitting the oil in the sink would clog your pipes. And it was like, okay, that's a lot. There was a reason that was 3,000 years ago, because we had different things. So now we're thinking of ways that we can do these ancient techniques that are more practical in today's society. So we do just a pinch of the coconut with hot water, doing a rinsing technique that I learned from the Ayurvedic community of just holding it in your mouth because the hot water will open the pores and the coconut oil will permeate everything. So in the morning you kill the bacteria, in the evening you can attack the acidity levels. Then Dr. Gross has created a product that incorporates the two, which is lovely because it's just a pill that you can take at night and the pill that you can take in the morning. And in addition to the benefits of the coconut oil and the benefits of the ginger in terms of neutralizing the mouth, the product also has some other wonderful things in it like turmeric and tea tree oil that can address some specific needs. I think what is really key in creating a holistic appointment, for me as the hygienist working on the patient, is to create an appointment that's customized to your needs. That was one of the things that I learned in school 30 plus years ago. And probably one of the challenges of creating a holistic hygiene modality is it's so much a part of what we are teaching hygienists and so much a part of what we do, incorporating the nutritionist and incorporating the other dental specialties, and certainly trying our best to create an individualized oral hygiene home care regimen for every patient. So when the holistic patient comes to me, I need to know what to say to them. So I did some research and looked around. So it's really exciting when the patient comes and I have patients. And that one of the things that has kept me as a hygienist all of these years, and the reason why I do it all of these years, is because I really, really love my patients. I love being able to see the change. When you don't have to have perfect teeth. I don't have perfect teeth. Close. However, clean teeth are pretty teeth. I believe that.